Hi everyone, I'm Melissa, a clinical dietitian in a hospital setting, and I work with patients who have to get their nutrition through a feeding tube that's usually in their nose or in their stomach. And we have an update for you on that process. Unfortunately, there's been a shortage of the equipment that you need to give yourself nutrition if you live with a feeding tube. So the shortage has resulted in a lack of feeding bags, and these feeding bags are necessary, as most of you know, with a feeding pump, and also to give yourself nutrition via gravity drip. So we are going to have to talk about other ways for you to give yourself nutrition when you no longer have a supply of those bags. Before you even get started with your bolus type feeding, you're going to want to make sure you have the right equipment. So we're going to show you a syringe, and then you're going to want to make sure that that syringe tip fits in the type of feeding tube that you have. So this is the feed and flush bag I was mentioning earlier, and this is the piece of equipment that we are out of. So today we're going to show you some other alternatives. So if you're going to be putting the syringe tip into your feeding tube to deliver your bolus, you would suck up the formula through the syringe just like this until you have the desired amount. And here we're going to do 60 mils. And then you would fit the tip of the syringe into your feeding tube and slowly administer the formula into the feeding tube. Before you do this, you're going to want to hook the syringe up to your feeding tube. So you're going to want the syringe in the feeding tube so that when you pour the formula in, you're not dumping it all over. And if you don't have the right equipment, you're going to want to make sure you contact your dietitian and get exactly what you need. Your dietitian is also going to help you with the amount of formula, the amount of flushes you're going to require. Another option is you can remove the plunger of the syringe